So we're going to be talking a bit about drinking today, and it's not meant to be a lecture on us telling you how much you're supposed to drink, how you're drinking too much. We're going to go through 3 different cases. These are very common in average people, and they kind of represent 3 different patterns of drinking that you can see in a lot of people. And we're just going to talk about, what are the things that they should be watching out for? What are the things that they should think about when they're engaging in these drinking patterns? So next slide, please. The first person we're going to meet today, his name is Joe, and he's just the average Joe. And Joe is a 45-year-old social drinker. He describes himself as a social drinker because he only drinks about once a month. And he only drinks when he hangs out with his buddies at the local bar. His favorite drinks to order are whiskey sours and Manhattans, and he has about 4 drinks per setting. So this is a typical scenario of someone who goes to the bar with friends, and they might have 3, 4, 5 drinks. It's a good time. So based on Joe's description, about 4 drinks per setting, once a month. What kind of category does he fit into according to Canada's drinking guidelines? Let's see if any of you have an idea, or take a random guess based on your feel. We're not expecting anyone to know exactly yet. So you can type in the comment section or in the chat, depending on if you're in YouTube or on WebEx, and we'll give you some time to let us know what you think. Just A, B, C, or D.
It's kind of interesting, is that, we have different opinions on that. And first of all, I have a lot of people I know that go out and play hockey with their buddies, and every time they play hockey, they have 4 beers or something. And is that okay? Or I guess it depends how much you play hockey in part. Be curious to see what your thoughts are, Rachel, and the rest of the team here. Let's go to the next slide.
All right. So what Joe is describing, it's actually a category of heavy drinking according to Canada's drinking guidelines, and specifically we call it binge drinking. So in order to qualify for binge drinking for men, they need to have 5 or more drinks in a single occasion, and for women, 4 or more drinks in a single occasion. And by drinks, we mean standard drinks, not glasses, not number of drinks. According to Joe, he says he drinks 4 cocktails at a setting, but we're still classifying them as binge drinking. And why is that? Because you'll know in a sec that cocktails actually have more alcohol than a single standard drink. So if you have a can of beer, it probably is a standard drink. But if you actually have a cocktail where they mix up different alcohols, you're likely to get more than 1 standard drink. So just to test everyone's background knowledge on the Canadian drinking guidelines, what do you think 1 standard drink means in Canada's drinking guidelines? And just as a hint, every single country has different standard drinks in terms of how many alcohol is in 1 standard drink. So put in what answers you think are the correct ones in the chat or in the comments. Okay. All right, so let's go on to the next slide and we'll see what the right answer is. So in Canada, 1 standard drink is defined as 13.5 grams of alcohol, or 17 mils of alcohol if you convert it to volume. And you can see that there's a number of different countries that each have different standards for what a standard drink is. UK in general, the United Kingdom has a lower threshold for what a standard drink is, and the United States have a little bit of a higher threshold for what a standard drink is. So if we know this information, then we can actually know exactly how much Joe is drinking in terms of the Canadian guidelines. What you need to know then is the recipes of the cocktails that he's drinking. And the recipes are really not a secret. You can ask the bartender, you can look at the menu in the restaurant, and you'll be able to figure it out. So if you look at the recipe for his whiskey sour here, this recipe contains 1.3 standard drinks. And if he drinks 4 whiskey sours in one occasion, that's 5.2 standard drinks. That qualifies for the 5 or more drinks per occasion binge drinking criteria. At the same time, one drink contains 200 calories. So if he drinks 4 drinks, that's 800 calories right there, just drinking alcohol. It doesn't even include what kind of snack he has on the side. So not only is cocktails a lot of alcohol, it's also a lot of calories because, as you can see, the recipe contains things like juice, syrup, which is basically sugar, and other garnishes and ingredients, which all have extra calories compared to just one plain, pure whiskey. Next slide, we have the recipe for his Manhattan, which has even more alcohol in it, but less sugar, so it's 1.6 standard drinks and around 190 calories. If he drinks 4 Manhattans in one occasion, then he's actually drinking 6.4 standard drinks. And again, that's considered binge drinking according to Canadian guidelines. So not all alcohol is created equal. There's different types of alcohols. There's beer, there's wine, there's distilled liquors like rum, whiskey, gin. All of them have different alcohol densities. If we go on to the next slide, people can try to take a guess at which one has more calories. All of these are one standard drink. If anyone is familiar with how alcohol is made, then they might be able to get the right answer. All right, we have someone saying a beer, which is right because the beer is less filtered than those filtered liquors. But there's something else in there that might have a higher calorie count. Exactly. Okay, let's move on to the next slide, and then we'll see. So beer generally, yes, it has more calories, and wine as well, because they're less purified alcohol. They have other contents in them, and the other contents are usually sugars, so more calories. At the same time, if any alcohol is flavored, like the coffee liquor, then it also has added sugars and hence added calories. So the correct answer is C. The coffee liquor has a lot of calories compared to if you just drink pure distilled liquor like a whiskey, which only has 97 calories. So when you're drinking, those calories add up very quickly. If you're drinking 1 beer every day for a week, you're drinking about, I can't do my math, but I would say 1,500 calories in a week that you've added up. And it only takes a couple thousand to gain pounds. So you might want to consider, if you're trying to lose weight, how much alcohol is contributing to your calorie counts. So let's go to the next slide. The message that we wanted to pass on in this case, in Joe's case, is to beware of cocktails and flavored drinks. Because most of the time when you're at a bar or a restaurant, a cocktail is at least more than 1 standard drink. It's often closer to 2. And it varies depending on how the bartender makes it and how the restaurant makes it. They also have added sugar, added juice, added syrup, and added calories from all the garnishes and flavorings. And bottom line is that when you're drinking cocktails, give a very conservative estimate in terms of what is your limit. And again, you can figure out the cocktail recipe by looking at the menu or just asking the bartender. They're usually very happy to tell you. Now, you might think that, I'm not like Joe. I don't drink that much on a single occasion. But the statistics say otherwise. 1 out of 5 people in Canada over the age of 12, which means this includes like high school students, they are regularly binge drinking, which means they're binge drinking at least once a month for a whole year. Males are more likely to be binge drinking than females. So this basically means that out of the 5 people you know, probably 1 has binge drank in the past month, or at least in the past year. And there are a lot of risks and health negative health effects associated with binge drinking, which Emily will be going over just now. Great. Okay, so I'll be talking a little bit about the risks of binge drinking. So as we specified earlier, but just to remind you, binge drinking is defined as having 5+, so at least 5 drinks over 2 hours for men, whereas for women it's having 4+ drinks over 2 hours. So there are both short-term effects and long-term effects to consider when we're looking at the risks of binge drinking. And under short-term effects, we have alcohol poisoning, so that can lead to death. So that just occurs when your blood alcohol content levels are way too high, and that's a result of binge drinking. Other short-term effects include having high blood pressure, an irregular heartbeat, also sudden death from heart failure. There's also increased urine and vomiting, which can lead to dehydration. And that's just because alcohol is a diuretic, so it's going to increase the amount and frequency that you pee. So that can lead to dehydration, and that leads to problems with electrolyte levels, for example. There's also something called the inhibited gag reflex. So if you've ever brushed your tongue using your toothbrush and you stick your toothbrush back a little too far, you'll realize that you actually have something called a gag reflex. But when you are binge drinking, that gag reflex can be inhibited. So things like vomit and saliva doesn't go out the right way, can enter the lungs instead, and that can lead to inflammation in the lungs. There's also hypoglycemia, so that's just a fancy term for low blood sugar. And then with long-term effects, we have increased risk for many cancers. So we actually have a slide specifically dedicated to that. So we will be talking more specifically about that later on, but some examples of those cancers include cancers of the liver, mouth, throat, voice box, esophagus, colon, and rectum. There's also increased risk of heart attack and hypertension. Hypertension is just high blood pressure. Also suppressed immune system. So we actually have a section on COVID-19 and alcohol consumption, and having a suppressed immune system as a result of drinking too much is obviously a problem because we're in a pandemic and no one wants to get the virus. There's also osteoporosis, which is just when your bones become more brittle and fragile, risk of stroke and dementia, and also higher risk of depression and anxiety if you binge drink. So one thing to note there is that some people will misuse alcohol, so they'll use it to, as Dr. Kearney mentioned, treat your nerves or help you sleep, but in the long term, it actually worsens those symptoms, so that's just something to keep in mind. But yeah, that's all that for this slide. And I think this is Stuart's slide, I'm not too sure.
Great. Okay, thank you, Emily. So a common point that you might say is, well, I don't drink too much, but whenever I go out, I do like to social drink because I have to. Now, that's not necessarily the case, and so I wanted to offer some alternatives to alcohol the next time you're in a social setting once COVID is something of the past. So when you're going out in a social setting, something that you might be looking for is something that keeps you engaged, tastes good, and it makes you feel like you're not standing out in the crowd. Well, there are many drinks that lack alcohol content that are made up of a lot of sugars as well, so it's important to be aware of these things. Right now, I just wanted to shine a light on a few options that you might be able to consider the next time you're out in a social setting but are not interested in consuming alcohol. Now, the first one is kombucha. Kombucha is a fermented and naturally sparkling drink, which is often made of either black tea or green tea, as well as sprinklings of bacteria. It's something that's really quite new and hip these days. There's a lot of people who have kind of transitioned to drinking kombucha as a part of their daily routine. Because it's not sugar-based, it's become a big hit with people who are my age, and its popularity is really quite soared. This is often something that you might be maybe have never heard of, so it's something that you maybe want to consider the next time you're in a social setting. Now, there's also non-alcoholic beers and wines. Non-alcoholic beers and wines are getting better and better with each passing year, and many breweries are stepping in to create tasty alternatives that don't contain any alcohol. Be aware, however, that there are some new alcohols that are either light or 0.5 alcohol versions. And so if you want an alcohol-free experience, be sure to just make sure that you are checking the can or speaking with the bartender to make sure that you are getting exactly what you're looking for. The next option is sparkling juices or even sparkling waters. Very similar to champagne or sparkling wine. This gives you the bubbles that you might be looking for without the alcoholic effect. And finally, mocktails. Mocktails are very much like cocktails but without the alcohol. Some examples we listed here are Shirley Temple's or Arnold Palmer. It is important to be a little bit more cautious with mocktails because without the alcohol, sometimes bartenders or companies will supplement with adding sugars. So if you are looking for mocktails, be sure to check out the labels to make sure that you are not consuming something that is overly rich in sugar, because that is obviously not something that you might want to be looking for in this setting. So the next time you are in a social setting and you go to grab a drink, there are plenty of options out there that are not alcoholic based, and we wanted to list a few here for you to consider.
Yes, so in summary, make sure that when you're evaluating your own alcohol habits, averaging across a whole month is not how it works. Alcohol, when we evaluate alcohol consumption, we do both by day and average, but they're not interchangeable. So if you're drinking too much in a day, that's still considered heavy drinking. Okay, let's meet our next case. So this is Kate, and she's got a very comfortable life. She's got a dog and good Wi-Fi. She's 42 years old, and she likes to have a glass of wine with dinner most days of the week, except on weekends where she has to work the night shift. So below is a schedule of when she drinks her wine. So she drinks Monday to Friday, and she doesn't drink on Saturday and Sunday. And on your right, you can see that she usually fills her glass to the level indicated. She has stemless and standard wine glasses. So, do you think Kate's drinking pattern is considered low risk according to Canada's drinking guidelines? And you can type your answer in the YouTube comments or in our chat. So A is yes, she is drinking within the low risk guideline. No, she's drinking more than what's recommended. Or C, I don't know. And it's totally okay to not know, because that's the whole reason we're having this presentation. All right, so we have a couple of answers. Let's move on. Had a couple of B's. So you guys don't really have confidence in her, do you? Let's go over what the drinking guidelines are first, and then we'll see how much Kate is actually drinking.
Okay, so I'll be going over the drinking guidelines, but before we do that, we need to first kind of clarify what a drink actually means. So a drink is not just like a glass of wine. A standard drink is, if we're looking at beer, it's about 341 milliliters, which converts to 12 ounces with 5% alcohol content. Or if you're drinking a cider or cooler, it's the exact same thing. So 12 ounces and 5% alcohol content. If you're looking at a 750 milliliter bottle of wine, that's going to give you about 5 drinks. If it's a glass of wine, which is supposed to be about 5 ounces, that'll give you 1 drink. But if you're taking a shot, that'll be about 1.3 drinks. So that's just kind of to give you an idea about what a drink looks like. And on the next slide, we're going to talk about some of the guidelines. So this is data taken from the Canadian Centre on Substance Abuse and Addiction. So for those aged 25 to 64, if you're a man in that age category, you can have up to 15 drinks a week, and that converts to 0 to 3 drinks per day. Conversely, if you're a woman, that's up to 10 drinks a week, and it's 0 to 2 drinks per day. So it's important to also plan non-drinking days every week to avoid developing a habit. So you want to set aside certain days of the week where you don't drink any alcohol so that you don't become dependent on it. And it's also important to check with a doctor or pharmacist before using alcohol when taking any medication, because if you're on some sort of medication, consuming alcohol can affect your body's ability to metabolize that medicine. And if you could just click one more time on the slide, something will pop up. So remember, consuming no alcohol is best, and that's because alcohol is a type 1 carcinogen. So that means that it causes cancer. So even though we've said for men you can have up to 15 drinks a week, and for women up to 10 drinks a week, those guidelines are actually quite high. So ideally you don't want to be drinking at all. That's the guideline, but again, we're not here, we don't want this webinar to turn into us lecturing you. We just really want to encourage you to take responsibility of your health and live the healthiest life that you can possibly live.
So mentions are very important. Type 1 carcinogen. What that means, it is without a shadow of doubt cancer causing. Is cyanide is a type 1 carcinogen. Tobacco is type 1 carcinogen. Alcohol is a type 1 carcinogen. When you see these numbers of 10 in women and 15 in men, that means you're addicted. So that doesn't mean these are safe levels, but that's a definition of addiction. So I think if you enjoy alcohol and drink it because you enjoy it, but realize you're taking a substance that does promote cancer, as we'll talk about, does promote atrial fibrillation, does weaken the heart. And we have these debates, and most people that I know of, we aren't really accurate in keeping track of their alcohol. So I always have this rule: is that 3 or 4 drinks a week is not unreasonable. It's sort of like 3 or 4 eggs a week, but that's something to think about. So, but I like this idea is that for your health, no alcohol is best. Remember, alcohol is not a health food. Take away.
Alrighty, so on the next slide, you might ask, what about special occasions? So we're in COVID right now, but once things get back to normal, what about drinking at a wedding, for example? So for those special occasions, remember these are guidelines. So again, consuming no alcohol is best. But for men, you're not recommended to have more than 4 drinks on any single occasion. For women, no more than 3 drinks on any single occasion. So some general tips are to set limits and actually stick to them. So as Dr. Kearney just explained, sometimes people aren't really keeping track of how much alcohol they are actually consuming. So that can lead you to underestimate your alcohol consumption. So it's really important to set limits and actually stick to them. Also drink slowly. So don't have any more than 2 drinks over 3 hours. For every drink, make sure that you're also drinking a glass of water because, as we mentioned previously, alcohol can lead to dehydration. And it's also important to eat before and while drinking. And finally, always consider your age, your body weight, and any health problems that you might have because that can suggest lower limits. So you might look at those numbers like up to 10 drinks per week if you're a woman, up to 15 drinks per week if you're a man, but it's important to tailor that to your own self. So make sure that you're within the lower limit there. Yep. And again, we have that little box here just explaining that consuming no alcohol is best. So that's the point that we really want to drive home.
Yes. And it's very important to realize that the guidelines are not a limit, are not a goal, they're a limit. And limits, you're not supposed to be near a limit. If I'm told my computer will explode at a certain temperature, I'm damn well going to keep away from that temperature as far as possible and not try to walk near it. So if you're drinking at the upper limits of the guideline, like if the guideline says you should drink no more than 10 drinks a week and you're drinking at 9 drinks a week, that is probably a time where you want to reflect on your drinking habits. Are you really aware of the risk that you're putting yourself in? Because as Dr. Kearney said, these are not safe guidelines. These are low risk guidelines, which means it's still a risk that you're putting yourself in, and you know what that risk is. So let's go back to Kate. Now that we know what the guidelines actually are, is Kate drinking within the guidelines? So she is a female who is 42 years old. So according to guidelines, she should be drinking no more than 2 drinks a week, no more than 1 to 2 drinks a week, 1 to 2 drinks a day, oh gosh, and less than 10 drinks a week. So these wine glasses actually hold about 6 ounces, which is a bit more than a standard drink. It's about 1.25 standard drinks, and adding them up in a single week, that's 7.5 standard drinks. So for those of you who have like no confidence in cake, she is actually drinking within the guidelines, and she has her non-alcohol phase. And for those who are interested, there's a handy drink size calculator that you can use. So you can calculate, depending on how much you pour into your cup, into your glass, how many standard drinks you're actually drinking. So Kate is actually drinking within the guidelines. But if we change up the condition a little bit, we'll see if she is still drinking in a bit. So what we've noticed first that she poured 6 ounces into her glass. And that's actually a common occasion that happens with wine drinkers who drink at home. Because when you're drinking in a restaurant, usually the restaurant, 1, because they want to save money, 2, because the servers are usually trained to pour wine properly, they usually pour the standard drink of 5 ounces. But when you're pouring at home, sometimes you want to indulge, or sometimes you don't know exactly how much you should pour. There are some cues that cause people to pour more wine at home compared to when they're at the restaurant. So one of these is wider glasses. So if you don't have a standard wine glass and the glass is wider than a standard wine glass, people tend to pour around 12% more alcohol or 12% more wine into the wider glasses compared to the standard wine glasses. And if you're drinking white wine, you're also more likely to pour more wine into your glass compared to if you're drinking red wine, which has more of a contrast between the wine and the glass. Last but not least, if you actually hold your wine glass in your hand, you're more likely to pour more alcohol into your glass compared to if it's set on the table and you pour wine into the glass. So next time you drink at home, make sure to put the glass on the table and ideally drink a dark colored wine and use a standard wine glass to make sure that you don't overpour. So at the same time, not all wines are 12%. The guidelines are based on the assumption that you're drinking a 12% wine, and we know that a lot of wines don't fit into this category. One of the examples is the lighter wines. So if you press next slide, which have less than 12% alcohol. And these are most sparkling wines. There's the Muscadet and the Riesling wines, German Riesling wines. They have less than 12%. So a tip is if you do enjoy drinking wine, you can consider picking wines with lower alcohol content so you can actually drink more volume if that's what you want. And then there's the wines with stronger flavors, which also means generally more alcohol content. And those are most of the dessert wines, the sherries, the ports, the vermouths, which are commonly used in cocktails. And when you're drinking these wines, you need to make sure that you're not pouring to the standard 5 ounces because that would be more than one standard drink. So actually check the labels on your wine bottle when you pour your wine and adjust your volume based on how much alcohol is actually in that wine. And I checked, when I was doing the slide, I checked the 2 bottles of wine we had in my house. None of them was 12%. One was 13.5, one was 15. So I actually don't have a standard wine at home. The same goes for all other types of alcohol. All types of alcohol, beer, distilled drinks, wine, they all have deviations from what the standard is. So next slide. So we have some tips for you to watch out for. So beer, watch out for what we call malt liquors or craft beers. These are beers that usually have higher alcohol content than 5%. They're usually around 6 to 8% and can go up to 15%. That's higher than the percentage of wine. So distilled drinks, they include liquors and spirits. 40% is often a minimum of distilled drinks. Like whiskey, you can't even call it whiskey if it's less than 40% alcohol by volume. Most distilled drinks have ranges that go above or go from 40% and above. And there are some specific types to watch out for because they have very, very high contents of alcohol. One is cask strength whiskey. They're usually higher than the standard. It ranges from 55 to 60. Overproof rum can go up to over 70% alcohol content. Absinthe can go up to 90% alcohol content, and Everclear can go up to 95% alcohol content. So be very careful when you're drinking these types of alcohol. These translate to actually very, very small volumes, so it's very easy to overpour. Okay, so next slide. Remember that low risk guidelines is exactly as it says. It's low risk. It does not mean no risk. There is no safe level of alcohol consumption. Red, bold, underline, italicized. Any alcohol intake will increase risk of certain cancers, and any benefit of alcohol in certain health aspects is offset by the harms of other health aspects, especially cancers. So again, we're not telling you to stop drinking right now, but you should know that you are taking a risk when you're drinking alcohol, any amount of alcohol, any frequency of drinking.
Alrighty, so I'm going to be speaking a little bit about the cancers that you can get via alcohol consumption. So just to kind of clarify and define some terms, light drinking is defined as having less than 1 standard drink per day. Moderate drinking is having less than 4 standard drinks per day. You really shouldn't be having 4 standard drinks per day, but heavy drinking is then more than 4 standard drinks per day. So knowing that, if we take a look at this table, we can see that if you are a moderate drinker, your risk for getting head and neck cancer is 1.8 times that of someone who does not drink at all. Okay, so if you are a heavy drinker, that number increases to 5 times. If we go down the list of cancers, we see the esophageal cancer. Esophageal cancer is really just cancer in your esophagus. Your esophagus is the tube that food goes down when it goes from your mouth to your stomach. So if you are a moderate drinker, your risk for getting that type of cancer is 2.5 times greater than if you did not drink at all. And that then doubles to 5 times if you're a heavy drinker. Similarly with liver cancer, if you're a moderate drinker, 1.4 times greater risk, heavy drinker, 5 times greater risk. And for colorectal cancer, your risk for getting that type of cancer, if you're a moderate drinker, is 1.2 times greater. If you're a heavy drinker, that increases to 1.5 times greater. And finally, for breast cancer, if you are a moderate drinker, your risk for getting breast cancer is 1.23 times greater than if you did not drink at all. And then that increases to 2 times if you're a heavy drinker. So those are a lot of numbers, but the main point of this slide is to show you that if you are a heavy drinker, your risk for getting cancer, it increases all across the board. So the take-home message here is that consuming less alcohol means that you are at a lower risk for getting these cancers. That's really all that there is to this slide, and yeah, we can move on to the next one.
Oh, just one comment. Mm-hmm. So please note that these light, moderate, and heavy drinking, they are just what the study uses to classify their numbers. It's not the guidelines. So if you look at the actual grams of alcohol, moderate drinking, 12.5 to 50 grams of alcohol, that's the upper limit of what the guidelines are telling you right now. This is why we're saying if you're drinking at the upper limits of the guideline, which is just 1 standard drink per day, you are already at a much higher risk of cancer than if you're not drinking at all. So light drinking is actually much less than what the guidelines are saying. And if you're following the guidelines and at the upper limit of guidelines, you're considered moderate drinkers. So just make sure that you know what these numbers actually mean.
Mm-hmm. Alrighty, so this is just a slide on alcohol consumption and prostate cancer. So I'll explain this graph here, but again, the same definitions apply about light drinking, moderate drinking, heavy drinking. So this study specifically specified that light drinking is having less than 1 standard drink per day, moderate drinking greater than 1 drink, but between 1 and 4 drinks per day, and heavy drinking is more than 4 standard drinks per day. So when you're looking at the data, it is important to consider how these studies define light, moderate, heavy drinking, because it can differ. So that's just something to keep in mind. But if we look at the graph, on the horizontal axis at the very bottom, you see this label called drinking level. So that's just tracking how much are you drinking. There's former drinkers, occasional drinkers, low volume drinkers, mid volume, high volume, and higher volume drinkers. So how much are you drinking? What is your drinking level? And then on the vertical axis, there's a lot of text there, but it really just says adjusted mean risk ratio of prostate cancer morbidity or mortality. So a lot of words. Basically what it means is what is your risk for prostate cancer? So if you look at the graph, the trend on the graph, you can see that the more volume you drink, so as that volume increases, the risk for getting prostate cancer increases a lot. So again, less alcohol equals less risk. If you are drinking less alcohol, that puts you at a significantly lower risk for getting these cancers. So yeah. So this is a slide on metabolic syndrome. This is just another one of the long-term effects of alcohol consumption. And if you're not aware, metabolic syndrome is really just a combination of some conditions such as diabetes, high blood pressure, and obesity. So those things can lead to greater risk for coronary heart disease and stroke. And coronary heart disease is just when the blood vessels that supply your heart tissue, where those become damaged. So that can really impair the function of your heart. So in this first chart that you see to the left of your screen, we're comparing the number of drinks you're having per day to your odds of having metabolic syndrome. So the reference point is having 1 drink per day. And if you have 2 drinks per day, your odds of having metabolic syndrome are 1.12 times greater than if you had only 1 drink per day. So what that means is the more drinks you have, the greater odds you have of having this disorder called metabolic syndrome. And if you have 3+ drinks per day, that odds actually basically almost doubles to 2.13. So on the right side of your screen, you see another chart, and that is just looking at if your drinking is exceeding the dietary guidelines that we previously discussed in this presentation. So if you are exceeding the dietary guidelines for drinking, your odds of having metabolic syndrome are 1.56 times greater than if you did not exceed the dietary guidelines. So the take-home message for this slide is if you are drinking more, your odds of having metabolic syndrome increase.
Just to put that into perspective, you can backtrack 1 slide here. So what I'm saying is an odds ratio, relative risk. So a relative risk of 1.12 means you're 12% more likely to develop metabolic syndrome. Which just means your pancreas is under stress. You're in the process of more likely to develop diabetes. 2.3 means you're over 2 times more likely to develop diabetes over time. So metabolic syndrome is usually that big belly, you're overweight, it leads to high blood pressure, it leads to future diabetes. And one of the things to remember is that alcohol would get converted into your body to sugar. And if you're a diabetic, you say you want to be smart, I want to avoid sugar. Well, drinking alcohol, you're not avoiding sugar, you're just going to make sugar and give yourself some extra toxic substances along the way. Thanks for sharing that.
Yes, so we talked about the risks of even moderate or low or light amounts of regular alcohol drinking. So Kate, let's go back to Kate. So we went over her drinking habits, and she is within the low-risk drinking guidelines in Canada. But what if, instead of 42 years old, she is a 68-year-old woman? Would her drinking pattern still be considered low risk? Is there a difference depending on how old you are? So feel free to type in the chat or in the comments on YouTube. Again, there's a reminder of how much she's actually drinking. Over a week, she is drinking 7.5 standard drinks per week. Think about what changes in the body when people are aging, and what risks may be increased when people are aging, and whether these increases or changes are enough to change guidelines. So let's move on to the next slide. So Canada actually has a separate drinking guideline for older adults. So that means for those over the age of 65. For men, it means no more than 1 to 2 drinks a day and no more than 7 drinks per week. So that's half of what's recommended if you're not over the age of 65. And in women, again, it's basically half of the guidelines of ages younger than 65. So in women, no more than 5 drinks per week. So if Kate is 68 years old and she's drinking the same as she was when she was 42 years old, then she is drinking, that she is at a high risk drinking level. And there are important considerations when we talk about drinking alcohol in older adults. First of all, they have a higher risk of falls because as we age, the muscles tend to get weaker, the coordinations tend to get worse, and we tend to have joint problems, aches and pains like arthritis, and all of that increases our risk of falls. If you add alcohol on top of it, we know alcohol can make people fall even in a very young and healthy person. And in an older adult, when you fall, you have much more negative consequences than if you were 25 years old. Falling, if an older adult falls, that might be the end of their independent life. They might break a hip and they might never be able to go down the bed again. They may never be able to walk again. And that might mean going to a nursing home for them. So falls is a very serious consequence when you're getting older. And that's part of the reason why the drinking guidelines have taken that into account and they've decreased the limit for drinking. Another important consideration is loneliness and isolation. And I guess that also applies to us now in the COVID era. So loneliness and isolation, when we drink, it affects both our physical health and our emotional health and our psychological health. And older people, some of them, when they retire, they tend to not be as social, or when they tend to not be as social, or when the children have all left the house, they tend not to have as many connections. And if they're in a nursing home, again, not much connections, a little bit of isolation. So when you feel lonely and you feel isolated and you turn to alcohol, that's a recipe for a not so well emotional coping mechanism. And that can lead to drinking problems, and drinking problems leading to more negative consequences. When they start becoming dependent on alcohol to get rid of the loneliness and isolation, that's actually a sign of a drinking problem. Third, an important consideration is a slower metabolism. As we get older, naturally our body slows down, and we can't digest and process and get rid of the alcohol as well as we used to be if we were, let's say, 25 years old. So that means alcohol will tend to accumulate faster in our body, which means the toxic effects will tend to accumulate faster in our body. And so combine that with an older age, less functions for some people, more aches and pains, maybe some medications, other diagnoses. That is a recipe for disaster in someone with older age. So slower metabolism of alcohol, again, contributor to why the guidelines are changed for people over the age of 65. The fourth reason, memory and cognition. So when we talk about old age disease, there's osteoporosis, there's osteoarthritis, there's also Alzheimer's. And alcohol can increase your risk of Alzheimer's, as well as if you have Alzheimer's, alcohol can decrease your cognitive function and decrease your memory and make Alzheimer's worse for you. And that's very reasonable, because even in young people, when you drink too much alcohol, you have blackouts and you can't think properly. You make stupid decisions. That's exactly what happens in older people, except they're even more vulnerable to the effects. And last but not least, medications. If you have any medical condition, if you are on any medications, you really shouldn't be drinking alcohol, or at least you should ask your doctor before you drink alcohol to see if you can actually drink alcohol, because a lot of medications interact with alcohol and you don't want to have those interactions. They can be very, very bad, and they can lead to death in some cases. So other than decreasing the limit for adults over the age of 65, The guidelines also specifically say, in the blue box there, for individuals approaching the 70s and beyond, or those with health conditions, it's recommended to decrease alcohol intake below these guidelines and consider not drinking at all. Because again, this is not a safe guideline, this is a low-risk guideline. And it assumes that you are a healthy 65-year-old with no other medical conditions whatsoever, which doesn't really fit for a lot of us.
So one of the things we're learning is that you want to stay out of the nursing home for as long as you can, if possible. And you mentioned falls, and once you have one fall, you lose your confidence. Your risk of future falls goes up. You may lose your ability to drive, to be independent. And losing the ability to drive is actually kind of important, and very important. If you actually fall and break a hip and need a hip replacement, most people never fully recover. You're left with severe impairment. So I worry about falls, and I worry about once you've had your first fall or you've broken a hip, your life is never the same. So this is important. And you mentioned there's also association now with alcohol in atrial fibrillation, congestive heart failure. We're talking all about cancers, and of course, just some no effects. So doesn't mean you can't drink, but realize that there are consequences. Thanks for sharing that, Rachel.
And another point I just wanted to touch upon, because I think it's really important, these drinking guidelines are of the assumption that you are perfectly good health, and so if you have comorbidities such as diabetes, congestive heart failure, or if you're taking any medications, these guidelines may not necessarily perfectly apply to you, and they're probably greatly overestimating the limits of how much you should really be consuming in a week. And so this can be certainly something that you can use as a conversation starter with any of your doctors, whether it's your family doctor, your cardiologist, and ask them how your medical conditions and how your medications may interact with your alcohol consumption patterns. You can also speak with Dr. Kernu and ask him how, through your ECGs, your echoes, your lab results, how alcohol is affecting the results that you're getting, and what you can potentially do to improve your heart health and improve your blood work and lab results, not just in the short term, but obviously in the long term as well. And this really brings us to the conversation that Dr. Kernu referred to, alcohol and the association with atrial fibrillation. And now for those who are potentially unfamiliar with atrial fibrillation or who need a reminder, atrial fibrillation is essentially irregular heartbeats, which is often called arrhythmias, which can lead to a number of other complications. It can lead to potential blood clots, it can lead to stroke, it can lead to heart failure, and many other heart-related complications as well. Now, atrial fibrillation, unfortunately, is associated with a number of complications, as I mentioned. Stroke, it can be heart failure, but also dementia, and also significantly increases your risk of all-cause mortality. Now, recent research has investigated the association between alcohol and atrial fibrillation. One fact that they have absolutely ascertained is that high alcohol consumption is associated with atrial fibrillation. But this begs the question, is low to moderate alcohol consumption associated with increased incidence of atrial fibrillation as well? And that's what we'll investigate now. So there was a study, and what they did was, this was a follow-up of 11 years, in which over 80,000 patients were investigated. After 11 years, they were able to identify over 7,000 individuals in a cohort who reported having cases of atrial fibrillation. Now, what I'm going to discuss next is how the amount of alcohol they consumed related to their risk of cases of atrial fibrillation. So as you can see right here, in comparison to an individual who may be drinking one or even less than one drink per week, you can see right here that light to even moderate alcohol consumption increases your relative risk of atrial fibrillation recurrence. What you can see right here is that with more alcohol consumed, there's a gradual increase in your percentage risk or increased risk of having atrial fibrillation, which of course can lead to the number of complications which I mentioned previous. They also did a meta-analysis in which they compared drinking per day to those who do not drink, or those who abstain from drinking. And once again, you can see that with increased amounts of drinking per day, the relative risk has a very similar trend in which it's increasing. So what does this really mean? There's a lot of numbers on the screen, but you might be asking, Stuart, what does this really mean? So essentially, in addition to binge drinking or consumption of large amounts of alcohol, moderate consumption, in this study, which they defined as between 1 to, I believe, 14 or so drinks in a week, was associated with atrial fibrillation. And atrial fibrillation, as I mentioned, is associated with a number of complications: stroke, blood clot, heart failure, dementia, and all-cause mortality, just to name a few. So we talked about how alcohol is associated with the increased recurrence of atrial fibrillation, but let's talk about the other way. Does abstaining from alcohol actually decrease your recurrence of atrial fibrillation? So this was a study which was recently done and published on January 2nd, I believe, of 2020. And essentially what they did was they gathered a cohort of 140 people. These were individuals who regularly drank alcohol, and what they did was they randomized them into two groups. A group where they abstained or significantly reduced their alcohol intake, or the control group, who consumed about the same amount of alcohol that they normally would. And you can see right here in this column that says atrial fibrillation recurrence, the amount of times in which an individual had atrial fibrillation was significantly reduced in the group that actually reduced their alcohol intake significantly. Essentially what this study is saying is that for those who actually reduce their alcohol intake in a week, they significantly also reduce the recurrence of atrial fibrillation. This was something where they saw results within 2 weeks, and they followed them up over 6 months, and they were able to see that abstaining from alcohol does decrease the risk of atrial fibrillation. So you can see there's a very similar trend where increasing the amount of alcohol intake increases your chances of atrial fibrillation, and decreasing it obviously goes the opposite way of decreasing your chances of atrial fibrillation.
Stuart, this is actually a very crucial trial. So what we've shown before is a lot of observational data. Observational data is not as powerful as randomized data. So to get into this trial, these were patients with known intermittent atrial fibrillation. And once some people get atrial fibrillation, their heart starts to bump and it goes all fast, goes all over the place. Some people are very, very symptomatic and their quality of life is quite impaired. You have to be on blood thinners when you have atrial fibrillation for most individuals because you're at risk for stroke. Having atrial fibrillation doubles total mortality. So we control blood pressure, weight reduction, controlling things like sleep apnea. But this is actually a randomized trial that showed that people who drank a fair bit, and they were asked to continue their drinking or to try to stop drinking. Now, they're asked to try to stop drinking. Most did not stop drinking, but they reduced their alcohol consumption sizably. And it showed that at the end of 6 months, there's recurrence rates of about 73% of people who kept their drinking habits the same, that they had a recurrence of their irregular heartbeat called atrial fibrillation, versus 53% recurrence. This is actually as good as many of the drugs that we utilize. People are going for ablations at this stage. So what we're learning right now is there's ways of treatment and preventing atrial fibrillation. And one of the best things is trying to get your weight down, controlling your blood pressure, and very, very importantly, not drinking alcohol. So in people who have recurrent atrial fibrillation, recommend no alcohol just on special occasions because alcohol can make atrial fibrillation more likely. Alcohol, as Rachel points out, is rich in calories, gains weight. Alcohol makes you more prone to metabolic syndrome or diabetes. So here's the situation. It's also a blood thinner, and so it makes you more prone to bleeds inside the head. So you can see the effect of this compound. We talked about cancer, but now this is actually effects on developing a very problematic rhythm it's becoming the most common rhythm disturbance. It is the most common rhythm disturbance that we face right now. So you can get rid of roughly 25 to 30% of episodes of atrial fibrillation by not drinking if you have intermittent atrial fibrillation. So to me, that's very powerful. And can I have 1 drink, 2 drinks? Well, your choice is up to you, but you can just see that atrial fibrillation is a big problem, and preventing recurrence is huge. And this is a game changer.
Yeah, thank you. So next, I want to talk about alternatives to alcohol at home. Now, obviously, with our current situation, many of us are staying indoors and staying safe, and this can potentially make it more likely to reach for a glass. You might be bored, you might come home at the end of the day tired from work, and this is your little reward. It's important to ask yourself, what is your motivation, or what is your reason behind picking up a glass whenever you come home or when you are home? And I wanted to touch upon a few conversation points or thoughts that you can potentially consider. Now, one is all about shaking up your routine. So it's important to recognize what sort of activity is associated with you grabbing a glass or pouring yourself a drink, and maybe try to change it up a little bit. For example, if you come home after a long day of work and you sit on the computer, and that's when you usually go for a beer, maybe try something else like going for a walk, turning on the news, reading a book, FaceTiming a friend, anything else that isn't associated with you sitting down and grabbing that drink and consuming it as you are doing your typical activity. Now, another thing you can try is designating other rewards. So if alcohol is something that you consider a pleasure and something that you sit down to enjoy as a reward at the end of the day, maybe consider something else. For example, you can try watching an extra episode of Netflix, or if you abstain or reach your goals of decreasing your amount of alcohol consumption, maybe go for an extra piece of chocolate or a little extra handful of chips. Something else to maybe substitute the pleasure or the reward that comes with you consuming alcohol. Another great one is exercising more. Exercising is a great way to boost your serotonin levels and dopamine. In other words, it makes you happy and it makes you feel good. So doing something like going for a walk around the block, whether it's at your own pace or really building up a sweat, exercise really boosts all of these hormones, and as I mentioned, and it can really just make you feel good and rewarding at the end of the day. Finally, it's important to recognize that there's a lot of sugar and carbohydrates in many alcohols, especially beers, as we had talked about. So instead of reaching for those, maybe try substituting something else. So if you are to stop or decrease the amount of alcohol that you consume, your body might be craving these sugars or these carbs that your body is so used to having. So maybe try reaching for something else, like a piece of dark chocolate or a sweet potato, which can kind of curb these cravings and make you feel satisfied without having to reach for alcohol whenever you are home. Again, it's really important to think about what is your motivation, what is your reason behind going for alcohol in a day, and thinking of ways that maybe you can shake up this routine.
So Stuart, you mentioned alternates. So am I having a vodka cooler or wine cooler? I'm just having bubbly, sparkling water. So alcohol content is 0, calories 0, lipid 0, sodium 0, glucose 0, protein 0. This is basically, it says natural, artificial flavors, whatever that means. So sparkling water is something I quite enjoy. And so I thank one of our kind patients to bring this in. So thank you. So just so here's one substitution.
Perfect.
Yes. So just as a summary, in Kate's case, we talked about alcohol within, regular alcohol drinking within the guidelines, as well as general light to moderate regular drinking, as well as the risk associated with even light drinking, which includes cancer, atrial fibrillation, heart disease, dementia, falls if you're older, and a lot of different medication interactions. So make sure if you have any health conditions or if you're on any medications, talk to your doctor before you drink alcohol. So we're on our last individual here. His name is Tom, and he's a little bit stressed out lately. He is a 40-year-old office worker who's been having sleep issues for a couple of years now. He says he needs at least 2 glasses of wine to help him sleep each night. He needs the alcohol to help calm his nerves and fall asleep. And that's the reason that he's drinking. So based on Tom's story, next slide, does Tom have a drinking problem? His reason seems pretty legit. He needs it to calm his nerves, and he can't sleep without it, and he needs to go to work the next day. And that's the reason why he's drinking. So do you think that if we solve his sleep issues, he'll stop drinking? Or do you think that drinking is actually causing his sleep issues? Or you're not sure? All right, we'll give, let's say, 10 seconds. Okay, let's move on to the next slide. So before we move on to what the correct answer is, let's bust a myth. A lot of people drink alcohol to help them sleep. That is a myth. So let's first define what a good sleep is. There's two phases of sleep. There's the falling asleep part, and there's the staying asleep part. You can't get a good sleep if you're lacking either one of those. Alcohol can help you with the falling asleep part. So it's true that when people say, alcohol helps me fall asleep, that's true. But it doesn't help you stay asleep. Actually, it makes you wake up in the middle of the night, even if you don't realize it. It makes your brain very active, and it disrupts your sleep cycles. So your sleep quality will be very poor, although you get knocked out much faster. So people who are misinformed, they often enter a vicious cycle of drinking to sleep at night and then not having a good sleep, so they're very tired and sleeping in the morning. So they drink coffee to stay awake during the day, and then during the night they can't fall asleep, either because of the caffeine, actually probably because of the caffeine, so they drink more alcohol to fall asleep again. So that's a vicious cycle they enter into, and as their body becomes more tolerant to the sedating effects of alcohol, they start to need to drink more and more to fall asleep. So this is basically what Tom is experiencing. He initially thought, I'm a bit anxious, I can't really fall asleep. Let me have a glass of wine to calm myself down so I can sleep. And it worked for him. He fell asleep because, again, alcohol is sedating. It suppresses your nervous system. So he fell asleep, and he's thinking to himself the next day, I fell asleep, so let's keep doing this. Let's self-medicate my sleep problem with alcohol. And before he realized that he's gone into this vicious cycle and he's developed a drinking problem. So the answer to the last question is yes, he has a drinking problem. His sleep issues are actually a result of his drinking. Next slide.
Yep, so basically this slide is just kind of further developing on that point of how alcohol consumption really does lead to sleep problems. So the myth that alcohol helps you sleep better is really not true. So let's take a look at this graph here. What this study did was it tracked the heart rate of different types of drinkers. So in the red line, you see people who are heavy drinkers. In the blue line, those are people who are moderate drinkers. Green line, people who are light drinkers. And then people who don't drink at all, those people are represented by the white dots that you see near the bottom of the graph. So what this study was looking at was heart rate of all these different people. So if you think about it just logically, heart rate is related to basically your quality of sleep, because if your heart rate is super high, you know that it's hard to fall asleep at night. So you can see that the heart rate of people who drink a lot more, who are heavy drinkers, is significantly higher than those who don't drink as much. So if you're looking at the horizontal axis, that's first hour, second hour, third hour, the number of hours after these people fall asleep, you can see that these people who drink a lot, their heart rates are still pretty high. So that really does negatively affect sleep quality. And if we're looking at certain statistics, we can see here on the right side of the screen that low consumption of alcohol actually decreases sleep quality by 9.3%. Moderate, that number increases to 24%. And then if you're consuming high levels of alcohol, your sleep quality will decrease by 39.2%. And here we're also going to talk a little bit about sleep apnea. So sleep apnea is a disorder where your breathing will actually repeatedly stop and start. So if you snore loudly and you feel tired even after you feel like you've slept for a full night, those are some symptoms of having sleep apnea. So if you drink any alcohol, you're actually 25% 25% more likely to develop sleep apnea than someone who doesn't drink any alcohol. So that's really important. The number 25 is bolded there. The word any is bolded there as well. So also the second point here is obstructive sleep apnea. That's one of the more common types of sleep apnea. That just occurs when your throat muscles relax when you're sleeping. So that contributes to the repeatedly stopping, starting your breathing. So if we're looking at how exactly does alcohol consumption increase your risk for sleep apnea, we can see that when you consume alcohol, that reduces something called your genioglottal muscle tone. So that's just a fancy term for your muscle tone in your tongue. So that can contribute to your upper airway collapsing. And so that is directly related to sleep apnea. And also, if you are consuming more alcohol, you're naturally increasing your caloric intake. So your BMI is probably going to increase. You're going to put on a couple pounds at least, and that's a risk factor for sleep apnea as well. So those are the ways that alcohol consumption is linked to sleep apnea.
Okay, so Tom, as he's been struggling with his sleep issues, he goes to the doctor and tries to find help for his sleep issues. And this often occurs in individuals who are misusing alcohol. They will present to a healthcare professional to seek treatment for something that's caused or exacerbated by the alcohol, so a consequence of their drinking, but they may not see the link of that consequence to their drinking. An analogy would be, "Doctor, I can't breathe." And the doctor says, or Dr. Kearney says, "Yes, because you have blocked arteries in your heart, we should treat your heart." But someone who may not see the link between heart disease and not being able to breathe will say, "No, but my problem is in the heart. It's my breathing, which should be my lungs." So this is an example of there's a lack of insight sometimes for people who are misusing substances, either because they were not informed, so misinformed in the case of Tom. He thought alcohol was helping when it actually isn't, or they're in a state of denial, which is one of the stages of change that we'll talk about in a little bit. Both of these scenarios, it's very important for us to intervene. And by us, I mean both healthcare professionals as well as friends and family members.
Okay, so now we're going to be talking a little bit about other risks of misusing alcohol. So we just finished talking about Tom, who is essentially misusing alcohol. He's using it to help him sleep. So on the next slide, we're going to talk about alcohol consumption and the risk of certain negative health outcomes. So these are just two separate sets of graphs. To the left of your screen, you see graphs that have to do with females, and on the right of your screen, it's for males. So in total, there were 28 million participants in the study. That's a pretty big number. And 649,000 were registered cases of respective outcomes. So if we're looking to the left of the screen, we see the set of four graphs. We can see here that there's an upwards trend or upwards trajectory for every single one of these negative health outcomes. So I can't quite read the screen, but the negative outcomes I think include ischemic heart disease, breast cancer, diabetes, and tuberculosis. So those are all diseases that you don't want to have, and the more alcohol you consume, the greater your risk for developing those negative health outcomes. If you're looking to the right of the screen, you see basically the corresponding graphs for males, except for breast cancer, which is replaced by, I think, lip and oral cavity cancers. So again, every single trend that you see here, the black line that you see, all of that is headed upwards. So that just means that more alcohol consumption or higher levels of alcohol consumption is linked to greater risks for all of these negative health outcomes. And on the next slide, you'll see a summary slide essentially of all of these negative health outcomes. So if you look at all of those risks, all those types of cancers and diseases combined, you can see that the more standard drinks you have, you really should not be having 15 standard drinks daily. So just keep that in mind. But the more standard drinks you have, the greater your relative risk is for developing these negative health outcomes. And that's just the key takeaway for this slide.
So we put that slide in. If you just go back one more, is that it's a large data set. It's huge, and we talked about before of cancers, then heart disease. So when I first started cardiology, we said that alcohol was good for the heart. It boosts HDL cholesterol. It's a blood thinner. And in fact, it does do those two things, and it may have some effects, but it has overwhelming effects. Is that it does. In people who have a weak heart muscle, it makes the heart muscle weaker. In patients who have atrial fibrillation or are going to develop atrial fibrillation, which is the most common rhythm disturbance, it's going to make that worse. And we also introduced, you saw tuberculosis. That means infection. So we'll talk about a little bit more about this. Is that so? Here's it. It said it makes you fall. It makes you have cancer. It makes you have heart disease. It makes you have dementia. And also increases infection now, and so another effects to think about. So, not trying to be preachy, and the more, the worse off you are. And I still think you can enjoy a drink, but you're also realizing it's not a health food, and you need to think about it. Is that really worth that balance? For myself right now, I'm doing everything I possibly can to keep my weight down. And alcohol is another factor in that equation too as well. So thanks for sharing that. And this is actually, you can find different studies, but this to me was, I thought, quite important because it's really a large data set.
Mm-hmm. Exactly. The 28 million participants is a very big figure. So as Doctor said, I think I've heard patients say that, isn't it like good to drink some red wine because it's good for the heart? Red wine specifically for some reason, and it's just important to remember that the negative consequences, the negative health outcomes of alcohol, it really does exceed any kind of benefit that you think red wine or any other type of alcohol may have. So that's the most important takeaway.
Yeah. So do you want to die of heart disease or die of cancer?
Yeah, just pick one of them, I guess. So that being said, we're going to talk a little bit about dependency on alcohol. So alcohol dependency is, just as the name suggests, it's when you become dependent on alcohol. So you keep on drinking it, basically. And this data was taken from an observational study. And basically what this study looked at was how we define dependency on alcohol. So the current DSM definition, which we will talk about later on in this presentation, doesn't actually include at-risk drinking in its definition. So if we diagnose people basically like, do you have a dependency on alcohol? Based on the current definition, the prevalence of that would be 3.8%. But that figure increases to 5.0% if at-risk drinking is included in the definition. So basically all that means is that if you drink more frequently, you're more likely to be considered dependent on alcohol. So essentially what we want you to understand, if you are drinking more frequently, you're more likely to become dependent on alcohol. So that's just something to keep in mind, which is why it's also really important to set limits and keep track of your alcohol consumption, because it's really easy to kind of just say to yourself like, oh, I'll have one more drink, or that's just something to understand, that you want to really set those limits for yourself.
Thank you, Emily. So this brings up a few important questions which you should ask yourself. Dr. Curnew often uses the adage that if you think you have a drinking problem, ask someone who cares about you or someone close to you, do they think you have a drinking problem? This is something called the CAGE questionnaire. And what it is essentially 4 yes or no questions, which are meant to assess the possibility of having a problematic drinking pattern. And essentially what it is it's an acronym based off of the type of questions that are asked. And if you test for 2 positive out of the 4, then this can often be an indication of a positive test, and the possibility of alcoholism should be at least considered or investigated further. So these questions are the following. Have you ever felt that you should cut down on your drinking? Have you ever become annoyed by criticism of your drinking? Have you ever felt guilty about your drinking? And have you ever had a morning eye popper to steady your nerves or get rid of a hangover? Now that last one is particularly important, and a lot of those who actually use this questionnaire will say that if you say yes to that one, then that would also be a consideration for a positive test. An eye popper, as it mentions, is somebody who first thing in the morning will go towards a drink to steady their nerves or either get rid of or calm down a hangover. And it's important to ask yourself all of these questions, which will kind of lead into the next topic of conversation, which I want to touch upon.
So if you just go back one more time, is that talking about alcohol for some people is very cultural, very sensitive. But I notice quite strongly if a person gets angry or annoyed or upset about talking alcohol, they probably have a drinking problem. And if the significant other in the family is worried about drinking, you have a problem. Now, if you wait for E, that means is that you're withdrawing from alcohol. You need to put alcohol in your system to prevent withdrawal symptoms. You really are really far advanced. And so people say things out of caring, and if people care for you and you get mad at them, and most people who drink too much don't see the problem. It's seen by other people first until it's well too late for most of us. So, just think about if what's the best choice for you.
And that's a nice transition into the next topic of conversation. This is the Jelinek curve. The Jelinek curve is a visual representation of what many people will suggest dependence on alcohol might look like. And as you can see in the Jelinek curve, it's certainly not something that's linear. You can see it goes down. There's a little bit of a loop at the bottom. You can't even tell how many times it may be looping at the bottom. And then there's this upward trend right here. It's important to understand that if you do have concerns about alcohol and you are working towards recovery, it's certainly not a linear process. It's not something that's easy, and it's not something that's even easy to talk about sometimes. As you can see, based on this visual representation, there's multiple sections of this curve. You can see that there's the downward trend. You can see that there's a very low point. There's a high point as well. And it's important to understand that everyone's track towards recovery is not the same. You may revert back to initial stages. You may stay in a stage for longer than you might want. You might have to repeat a few stages, as I mentioned, and that's okay because you're trying. And with each experience, you're learning a little bit more about yourself and a little bit more about how your body reacts and how your mind works when it comes to understanding and interpreting your behaviors when it comes to alcohol. Now, as you can see, there are 3 basic stages, and I'll touch upon them now. The first one is the crucial phase, or the crucial stage. At this stage, this is usually the initial point of addiction, where a person may not necessarily recognize that they have a problem. Their behaviors have never led to any negative consequences, whether it be with their health or otherwise. And so at this point, they've never really considered it to be an issue that they need to resolve. At this point, there may be many different experiences. They may be using alcohol as a form of relief, but it also may be commonly impairing their thinking. And you might notice that an individual is either retracting away from their friends or their loved ones. Now, at the very bottom, we have something known as rock bottom, and this is considered the chronic stage. The chronic phase is basically the representation of an addict reaching a low. Things that will often happen at this phase is there's a vicious cycle or a cyclic behavior of obsession with drinking. And this can manifest in many different ways. It can manifest as denial, aggression, frustration. It really does depend on the individual. And an individual can stay at this point for longer than they might anticipate. They might stay at this for many, many years. But as you can see, there's also a recovery phase to this diagram. That's known as the rehabilitative phase. Now, according to this curve, the rehabilitative phase is when an individual makes an honest effort and an honest desire to seek help and understands that their addiction is an illness and not something that they've chosen for their life, but something that they can work towards improving. And so this starts the road to recovery, rehabilitation, getting back to a healthy, sober life. At this point, you might see an individual learning alcoholism is an illness. They may be meeting with former addicts or meeting with counselors, speaking more with their friends and family, seeking new interests or rediscovering interests that they used to enjoy and love. And at this point, this is where they're really trying to reach the end point, or the point where they're no longer dependent on alcohol. And this shows how addiction can grow from something that is maybe a seemingly harmless behavior, maybe to spiraling out of control. And so I think it's a good diagram just to understand as a visual representation of what addiction might look like for an individual, whether it be somebody that you know or somebody that is really close to you. I hope this maybe just gives you a bit of an understanding of the different stages in which they may be cycling through. And next, we'll pass it along to Rachel, who's going to be talking about a few symptoms of drinking according to the DSM.
Yes, so this is going to be a little exercise. I want you to all be engaged and follow along. So this is based on the criteria of substance misuse on the DSM-5, and you can replace alcohol with other substances like caffeine, drugs, chocolate cake. I want you to think of someone who you think may have a drinking problem, or someone who you think may have another substance problem. For me, maybe chocolate, maybe not. And mark it down. So for each criteria that you qualify for, mark a point down. And then in the end, we'll be able to assess how much of a misuse problem you have in that particular substance. You don't have to tell anyone what your score is. Okay, so let's get started. First criteria is the individual often drinks in larger amounts or for longer periods of time than intended, or uses a certain substance in larger amounts or for longer periods of time. And as you're thinking about yourself or a person that you know, I'm going to talk about Tom. So Tom, in his case, he initially only drank 1 glass of wine a night, but he gradually started to fill a second glass before he's ready for bed. So he does qualify for this first criteria. Second criteria, the individual has more than once wanted to or tried to cut down their substance use, but was unsuccessful because they were craving it too much, they had desires for it, or they suffered side effects from cutting down. So in the case of Tom, he tried multiple times to stop drinking before sleep, but he finds that he could not sleep without the wine, and he always went back to drinking a few days after. So he also qualifies for the second criteria. Now we're going to move on to the third and fourth criteria. Next slide. So all of these criteria that we're talking about, 1 to 4, they're all impairments of control, as you'll realize. So the third criteria is the individual spends a great deal of time on drinking, obtaining a drink, or recovering from the effects of drinking. So they're basically preoccupied with their substance use. And for Tom, he is recovering from the effects of drinking. He's tired most of the day, even when he has a drink at night for sleep. So the sleep issue is really bothering him, and that's an effect of his drinking. So qualifies for the third criteria as well. And again, remember to mark down any criteria that qualifies for whatever substance use that you are thinking of. Fourth criteria, the individual has a strong craving for the specific substance, or wanted that substance so badly that they cannot think of anything else. So craving is basically this criteria here. And for Tom, he doesn't really have a craving. He usually just takes it because he needs it for sleep. Criteria number 5, drinking or being sick from drinking has prevented the individual from fulfilling their major role obligations. So if it's another substance, it's basically using the substance or suffering from side effects of using the substance have prevented you from fulfilling your roles. So this includes at work, at home, and at school. So if you're a student, you might be missing your deadlines, you might be performing less, you might be failing exams. At work, you might, again, be missing deadlines. They're everywhere in life, aren't they? You might have conflicts with your colleagues. You might have your boss telling you, your numbers are not looking so great this month. And at home, if you are a parent, are you taking care of your children properly? Are you going to pick them up on time? Are you getting them to school on time? Are you taking care of the house properly? So those are examples of major role obligations. and how they can be affected when you're using a substance. So mark down anything that qualifies, and then let's move on to 6 and 7. So number 6 is the individual continues to use the substance despite it causing problems or concerns from families or friends. So in Tom's case, his wife got mad at him a number of times when he took out the wine before their 6-year-old son has gone to bed. So a lot of parents, they don't want to drink in front of their kids, which is a very reasonable thing to do. So his wife got mad at him, and she told him, you shouldn't drink before our son goes to bed. And a number of times, which means he was doing it repeatedly. So he also qualifies for number 6. Other examples of troubles in your social relationships, including you basically not contacting them anymore, or having conflicts, arguments with your family, especially when you did the CAGE questionnaire, you did say you get annoyed when people bring up your drinking. That could be a source of conflicts and troubles from family or friends. So number 6, relationship problems. Number 7, the individual has cut back on activities that are important, meaningful, or pleasurable in order to drink. So examples include family time. Maybe you used to watch a movie as a family every week, but now because you wanted to drink by yourself, you don't want to go watch the movie anymore. Or you are this very social person that used to go out with friends all the time, and assuming COVID hasn't affected you, you don't go out anymore because you want to drink. Similar things like sports participation, other social events, other like regular routines that you used to engage in, or other hobbies that you used to have, you're not really doing them anymore because you want to drink. Fortunately, this does not apply to Tom yet, so he doesn't qualify for this criteria. Alright, so mark down whatever qualifies, and let's move on to 8 and 9. So 8, the individual has engaged in unsafe practices while under the influence of alcohol. Specifically, unsafe meaning dangerous to the physical body. So this includes while under the influence of alcohol or whatever substance. I don't know how chocolate cake can affect this, but whatever substance you're thinking of, like in terms of alcohol, it's drunk driving, unsafe sex, swimming when drunk is very, very dangerous. Operating heavy machinery is very dangerous. So if you've engaged in any dangerous acts while under the influence of alcohol, you will qualify for this criteria. Fortunately, Tom has not. He's an office worker. There's limited risks in that. Okay, so number 9. This individual continued to use the substance despite having a physical or psychological condition that is likely caused or made worse by alcohol or whatever substance. If it's chocolate cake, maybe diabetes. If it's alcohol, everything that we talked about, like atrial fibrillation. Maybe you have liver disease. Maybe you have a higher risk of cancer. You're at an older age. You have mental health issues. Those are all physical or psychological conditions that can be caused or made worse by alcohol. If you have a doctor that has told you, you have this disease, you probably shouldn't be drinking alcohol, but you're still drinking alcohol, then you will qualify for this symptom or sign of a drinking problem. You might have a drinking problem. So Tom does not yet know alcohol is not helpful for his sleep, which is good. However, if he continues to drink after the doctor tells him that alcohol makes his sleep worse, then it is a sign of his drinking problem. Similarly, again, if he has another diagnosis that basically tells him he shouldn't be drinking, then it is a sign of a drinking problem. So for everyone who has heart disease, who has higher risk of cancer, family history of cancer, or has a higher BMI or metabolic syndrome, your doctor has told you probably shouldn't be drinking and you're still drinking, you might want to reevaluate whether you actually know the risks or whether you are actually mindful of your drinking. Alright, so that's number 9. Only one more slide. Almost there. Hopefully you guys are keeping track. Number 10. For that individual, more drinks are needed to obtain the same effect, or there is less effect with the usual amount of drinks. This is the definition of a tolerance and dependence. So basically, Tom initially only needed 1 drink to go to sleep. Now he needs 2. He fits in that criteria. Or you initially only needed 1 cup of coffee to make it through the day. Now you need 5. You also fit this criteria. Okay, so number 11. So this individual experiences withdrawal symptoms when they're not using the substance, or they use the substance in order to relieve the withdrawal symptoms. Sorry, this is the definition of dependence. The other one was tolerance. So if you're using the substance not really to their own effect anymore, but rather to escape from negative consequences of not using them, then that's becoming a problem. So for example, for people who use opioids, which is pain medication, when they initially started, they might be using it to get high. That's why they started using it in the first place. But if they stop using it and they start feeling very lousy and like they even start feeling pain, then that's a sign of dependence. Or if they're using the opioid not to get high anymore, but simply to not feel lousy, that is a sign of dependence. So for alcohol, withdrawal symptoms include trouble sleeping, cough, cough, that's what Tom has, shakiness, restlessness or anxiety, nausea and vomiting, sweating, a racing heart or irregular heart rhythms, or a seizure. They may also have hallucinations, which means they hear, see, or feel things that are not there. That can be very scary if you start having hallucinations. Withdrawal symptoms, these withdrawal symptoms can actually become quite severe and life-threatening. And this was the reason why LCBO was not closed during COVID season, because they didn't want to cut off access to alcohol because people would go into withdrawal, and that's very bad, and that's going to fill the emergency department very fast. Okay, so hopefully you've all kept track of that person or that substance you're thinking of. And let's go on to a question there. The next slide. So this question is, how severe do you think Tom's drinking problem is? But really, if you were thinking of someone else or another substance, you could rate it as follows. You could rate it according to what scores you got. Of course, I'm not going to tell you what scores correspond to which levels. You just have to guess according to how many points you got, and then we'll tell you later. So for Tom, as you're thinking through this, for Tom, he didn't choose to have a drinking problem. He started unknowingly, and then started having to have more drinks, had a few arguments with his wife, but he hasn't done anything dangerous yet. He's not spending too much money on it. He is suffering from the side effects, having sleep problems, tried multiple times to quit, but couldn't really because sleep problems. So what do you think Tom's level is? How severe do you think Tom's drinking problem is? We've got a couple answers now. Oh, someone commented on coffee. Great. All right, so if we go to the next slide, here are the criteria or the scoring system for classifying substance misuse. So mild substance misuse, whatever substance that is if you meet 2 to 3 criteria. And it seems like it's very easy to meet 2 to 3 criteria. Moderate is 4 to 5 criteria, and severe is 6 plus criteria, 6 or more criteria, isn't it? And for Tom, he's actually moderate severe, depending on how strict you look at the criteria. He has a pretty severe drinking problem. And when you look at Tom, I mean, he probably will look the same as a regular person. He doesn't look like what the stereotypical addict image will be. Just to challenge some stereotypes, like addicts, there's no addict look, really. Many people who are addicted to substances, they don't choose to do so, and sometimes you can't really know from the outside, but they really do struggle with it. So according to the DSM-5, Tom has a moderate to severe drinking problem. And so he needs help. And hopefully that visit to the doctor for the sleep issue, that doctor will be able to point out, hey, you got a drinking problem. Let's fix that drinking problem, and your sleep issues will follow. Okay, so that's the formal criteria for substance misuse, but I think there are also other very important points, other important questions to reflect on, because they can severely affect your quality of life, even if you don't meet those criteria, and that's on the next slide. So the other red flags I think are very important that's outside the formal criteria is, have you ever lied about or wanted to lie about your drinking? I feel like if you ever wanted to lie about something, you probably felt guilty about it. You probably had thought that you probably shouldn't be using this much. You probably shouldn't be drinking this much. And that's actually a good thought to hold on to. Not the lying part, but the thought of you probably shouldn't be drinking so much. Because that's actually you realizing there's a problem, and that's very valuable. But if you actually wanted to lie about it, that's a red flag, and you want to just pause and reflect on your drinking or whatever substance you're using. Have you ever had any legal problems because of alcohol? Not just driving under influence. You can have loss of employment, loss of custody. Any legal problems, they kind of indicate a certain type of severity to your problem. Are you spending a significant amount of money on the substance, in this case alcohol? So again, it's not formally in the criteria, but I think money matters a lot to many people, and it is a very important part of quality of life. So if you're spending a significant amount of money, you're buying a lot of alcohol every week, and a lot of your budget is going into alcohol or cigarettes or coffee or chocolate cakes, you might want to reflect on your substance use. And last but not least, are you caring for yourself adequately in terms of personal hygiene, nutrition, and overall presentation? When people become preoccupied with substance use, they start to lag in self-care. So maybe they don't really look as well presented as they used to be. Their clothes may be a bit messy. They might not be eating very well. Alcohol can cause a lot of nutritional deficiencies. They might not be eating well, they might be nutrition deficient, or in terms of other substances, they might be eating too much, and they might be gaining a lot of weight. So are they caring for themselves adequately? Or are you caring for yourself adequately? So these are questions to internally reflect on, because no one can really know what you think about your behaviors. But there are some things that others may notice on the outside, and that's on the next slide. So if you're worried about someone you know, and you think they may have a drinking problem, there are signs that you can look for. Now, not everyone displays these signs. As we said, sometimes people can look completely normal, but if you know them well enough, you might be able to pick out some changes in compared to how they were before. So one, it's a pretty obvious one. If they have this, they probably have a severe drinking problem. One is if the individual smells of alcohol during odd times, like during the day while at work, where they're not supposed to be smelling of alcohol, or they might look disheveled. So the personal care aspect, they're not looking as well presented as they used to be. Now, if the person is usually a very casual dresser, then it doesn't really apply. It has to be a change from their previous level. Number two, if you notice that friend or family member has a change in their personality, their mood, or their behaviors. This could go both ways. They could be very depressed compared to before, or they could be very high or anxious compared to before. You have to know the individual to be able to find out what the change is. Number three, they have declining performance at school or at work. And this is unexplained declining performance. You know, if they had an event in the family that was causing them to not be able to focus, then it's an explained declining performance. But if there's no explanation for it, and they're like failing exams and missing deadlines, then you might be worried that there's something else going on, and it might be an alcohol problem. It could be many other things. Number four, less interested in usual hobbies, activities, and other things that they used to put as their priority. So maybe they liked going for walks with you, or maybe they liked going to sporting events, but you realize that, you know, they're declining more, they're not really connecting with people as before, or their priorities have changed, that might be a sign of a drinking problem, or actually any substance use. And number 5, declining health, new health problems, or unexplained scrapes, bruises, or injuries. Alcohol can cause a lot of health problems, as we said before, and they might not realize that health problem is due to their alcohol, but you as a bystander looking from the outside can see that their health is declining. And the unexplained scrapes, bruises, and injuries is just if they drink too much alcohol and they fall, or they have a blackout or a memory lapse, then it's going to show, but they may not notice it, but they may not think it as important because they're preoccupied with drinking. So these are some signs that you can look for. But again, make sure you don't start putting people in boxes. You need to really know them as a person.
Well, thank you, Rachel, for that activity. You know, it's funny, I'm certainly not in denial about how much coffee I drink in a day, but as I'm sitting here and I'm going through my score, I got a moderate score. And usually I make a coffee whenever I'm doing these presentations. I didn't today, and I'm starting to get a bit of a headache, which is telltale signs of withdrawal, I think. So what does that say about me? So then I think that's an interesting tie into the next topic of conversation, stages of readiness for change. The stages of change can be applied to a range of behaviors, not just alcohol, as Rachel was referring to. There are a number of different behaviors that we may want to work towards, but we may find it difficult to do. So right now I want to talk briefly about the 6 common stages of change, and more specifically, I want to talk about how you can actually be a resource for somebody who may be struggling with something that they want to change in their life. And I want to talk about how you might be able to support them in that. So you'll see right here that there's 6 stages on the screen, and very similar to the Jelinek curve, life is not linear, so why would you expect changing something that is difficult to be linear? This is what the stages of change typically looks like. As you can see, it's quite circular, but in the middle, you got a bit of a spiral going on. And I think this is quite important, because if you reach the final stage, you'll see that it's relapse. And while not everyone may go through this stage, it's important to recognize that relapse isn't failure. Relapse is an opportunity to learn from this experience and continue to work towards your goal of reaching the maintenance stage and staying in the maintenance stage, so you can stay on your goals for the long term. So I'm briefly going to go through all of the different stages. The first one is the pre-contemplation stage. You might hear someone say at this stage that, as far as I'm concerned, I don't have a drinking problem. Or in Rachel's case, I don't have a problem with chocolate cake. So there's no awareness of a concern at this time, and changes are only made under pressure, and it's not something that's going to be sustainable for the long term. If you tell someone to change their behavior but they're not interested in hearing it at that time, they're far less likely to pursue it for long periods of time. So it's important to ask yourself, how might you be of some service to an individual who is at this stage in their life? Well, first, you can avoid forcing them to make a change, because as I mentioned, these changes are not sustainable and will not last. You can also encourage them to self-care and speak to their doctor. Now, of course, speaking about alcohol is sometimes a difficult topic of conversation, and so it's something you might have to gradually ease into over time. And accessing or introducing the opportunity for resources, including your family doctor or your cardiologist, is a good topic of conversation to introduce when the patient is ready at that stage. Now, you can also describe out loud how you feel your life has been impacted by the changes that you've been experiencing in the individual. You can listen and validate your concerns for them, and of course you can reflect on how you may have enabled this behavior yourself, so you can continue to make steps to help them and improve yourself as you go forward. Next is briefly the contemplation stage. You might hear someone say at this point that I may have a drinking problem, but at this point I'm not really ready for a change. You can see that this individual may be interested in listening, but they're not really necessarily ready for the action yet. These individuals may often be experiencing a motivational crisis. There may be a sudden health concern potentially that popped up. And so they're now interested in learning about, okay, how is my drinking problem contributing to my diabetes? They may not necessarily lead to action yet, but you're planting a seed in their brain, and they're willing to listen to you. You can see right here on the image that there is a very distinctive trend in this stage. At the very beginning of their addiction, their motivation to change is quite high. But as you can see over time, if you go through the pre-contemplation stage, you may not necessarily be interested in it. Eventually, if there is a motivational crisis, their motivation may gradually rise again, and they may be more willing to listen. Now, how can you help in this stage? Well, you can continue to voice the concerns that you have for the individual in terms of their drinking. Again, you can continue to sympathize and validate their concerns and recognize that what they're going through is not necessarily a choice. Rather, it's an illness and something that they want to work towards. You can also help them consider the benefits of making a change in their behavior and reminding them of all the fun things that they may have done in the past, which may have taken a backseat to their drinking. You can also encourage them to visit a doctor and seek a health professional, and again, educate yourself on the experiences of people who commonly go through drinking problems. Again, you may not be seeing it from the same perspective of the individual, so it's important to recognize that. Next is the preparation stage. An individual may say, I'm planning to do something next about my drinking in the next 6 months. So these individuals are now making the plans, they're setting the groundwork for making a track towards recovery and seeking assistance. They'll likely experience a number of false starts, setbacks, and it's again not going to be a perfect straight line to the finish. So how can you help this individual? Well, you can continue to encourage and support their beliefs that they can change. Be motivational for them and be their rock, their support. If you don't believe in them, there's no way that they will believe in themselves. Do not berate false starts or make them feel guilty for a failed attempt. Again, a relapse is not a failure. A relapse is just an opportunity to continue to learn. You can also, again, understand that this is a process of trial and error. And if they're open to trying new things, it's good to have discussions about this and be open to their many different ideas. And again, at this stage, it's important to take care of yourself. Here we've reached the action stage. At this point, you may hear an individual say, here, I've taken the steps to address my drinking in the last 6 months. These individuals have reorganized their life in roles to support recovery. They are now confident and committed, and they may no longer experience symptoms and have developed skills to cope with triggers. So how can you help this individual? Well, they may have expectations that are in keeping with the individual in recovery. Therapy can feel like a full-time job, and supporting someone in therapy is also hard on yourself. Continue to cheer them on and also take care of yourself. You can celebrate and remind them of their success, following up on a regular basis, and support them as they replace alcohol with new activities, whether it's ones they've done in the past or it's new activities that they're soon discovering. Here is the maintenance phase. At the maintenance phase, you may hear someone say, I'm working to maintain the changes that I've made. So these individuals now have likely stopped their drinking or significantly cut back on their drinking and are now working towards other things that may bring them joy and happiness in life. They're living productively, they're taking active steps to continue to not relapse and make sure that these changes are working for them in the long term. So how can you help this individual? Well, you can help identify what has worked for them and make sure that this is their focus and it stays in the front of their mind at all times. You can remind them of the benefits that they are continuing to have, both on their physical, mental health, and also what you are seeing from them. You can list all of the positive changes that you've noticed over the past few months, and you can help come up with plans to deal with the situation should they ever take a few steps back. So this is
just gonna say, we've mentioned a lot of times in there to remember to take care of yourself when you're supporting others, and I think that's very, very important. Mental health issues, which is partly addiction issues, they're contagious. If you don't remember to set boundaries and take care of yourself, you can start feeling guilty for not being able to help. You can start feeling frustrated that they're not changing fast enough. All of these feelings are not beneficial for the individual who is trying to deal with their drinking problem. And I know, when you have a loved one or a friend who you can see is engaging in an unhealthy behavior, like drinking, you really want them to change. And you might be very motivated to help them through. For example, I know my dad, he has gout, but he likes seafood and drinks with seafood. which is bad for gout. And, as a friend or a family member, if you read online, you might say, okay, let me cook something that's not seafood, and then let's engage in healthier behaviors together. Or, for example, if you have a friend who don't like exercising, who is having an eating problem, as a friend, if you read online, you might say, okay, here, I got this gym membership. Let's go to the gym together next week. And, they might say, yes, sure, while you're giving them that suggestion. But then as the week comes, Monday comes, they don't go to the gym. And when that happens, which does happen, and it's for a lot of people who's dealing with these issues, people who made the suggestion, who are trying to help, can be very frustrated. They're like, why can't they change? Like, why can't they just be as healthy as I am? And that is a mindset that we need to be mindful of. Once you get into that mindset, it's not very helpful for whoever is trying to make that change. Just realize it's very hard to make health changes. Like, think back to a habit that you have that may not be as healthy, but the other person is healthier than you. Like my dad, he doesn't eat well, but he exercises every day. And I am a couch potato. I don't exercise. It's very hard for me to pick up my feet and go outside and exercise. But he's much better in that aspect than me. So we've all got our advantages and disadvantages. We've all got our problems and our strengths. And it's very important to realize that. And it's very important to realize that your happiness is not based on someone else's behavior. If someone doesn't do the changes that you think they should do, that's not reason for you to feel guilty. That's not reason for you to feel frustrated because it's their health, and you're not responsible for their health, but you just wanted to help them as a friend. Whether they take the help or not, it's up to them. And they all need a process to go through. It could be a few months for some people. It could be a few years for some people. And as long as you've done all that you could, that's good enough. Don't beat yourself up for it. Don't beat other people up for it for not changing, because they all need a process. To now, I still have not been able to stop eating chocolate, but that's my process. If anyone is frustrated, deal with it. Okay, next.
Thank you, Rachel. All great points. I hope everyone can still hear me. I'm trying to sort out the glitches on my side of things, but I just wanted to briefly talk about stigma surrounding alcohol. Now, stigma, as kind of Rachel potentially alluded to, is any negative perceptions surrounding a certain behavior, an action, or a belief. Now, stigma, as you'll see on the screen, is almost always seen in a negative light. Whenever we say stigma, there's no real positive connotation to it. But we often hear the phrase as well, break the stigma. Stigma is often more than just simply trying to hurt someone's feelings, whether it's intentional or unintentional. In the grand scheme of things, stigma is inherent in the community that we live in right now, and the whole world at large. And it doesn't just relate to alcohol, it relates to a number of other things. In this case, it could be described as prejudice or discrimination of others for something that necessarily is not in their control. And stigma can obviously have a number of adverse consequences. Rachel alluded to mental health. Obviously, it can lead to some feelings of self-depreciation and mental health decline, but it can also lead to a number of other consequences as well, such as you losing your job or your livelihood as a result of the stigma that has been projected on yourself. You may fear seeking services, potentially even healthcare, if you have been a subject of stigma in that field. And you may also eventually end up reverting back to your habits and becoming even more dependent on the alcohol in this instance. And obviously the stigma is not helping in that case or that regard either. So what are some ways that we can break the stigma? Now you'll see on the screen right here, these are just a few points, or at least things that I wanted to plant a seed in your brain, but there are a number of others as well. I just want to read off a few of them right here. The first one is to humanize substance use or mental health concerns. In this case, it's important to educate your friends, your family, healthcare professionals, or anyone in their community. There are many reasons why people may develop a dependence, and it's not because the individual is lacking any judgment or self-control. There are often a lot of misperceptions around alcohol dependence or mental health. It's important to recognize that alcohol dependence is an illness and, of course, never a choice. Next is to focus on the individual, not simply the behavior or the action that you stigmatize. Many individuals who have a dependence on alcohol have a lot of positive, in fact, many positive contributions to society. And they're just as much an individual who has feelings and sympathizes with others as you do. It's important to highlight these many positive contributions that these individuals provide to our communities, to our families, and the people that we love. And finally, ask yourself, what feelings do you harbor? Do you contribute to stigma in any way? Do you contribute to stigmatizing yourself or others? These are just 3 topics that I wanted you to consider. And again, I really wanted to emphasize that in the case of alcohol dependence, it's never a choice. Alcohol dependence is an illness and something that continuously requires support from family, friends, healthcare professionals. You don't have to suffer through it alone. There are many resources which I'm now going to refer to, which you can check out if it is something that interests you. Or at least I'll refer to them in a little bit. First, we're going to talk about alcohol and the association with COVID-19.
Alright, so this is just a very short mention because I feel like in this era, if we don't mention COVID-19 in a webinar, it's not complete. So, alcohol and COVID-19. According to the Canadian Centre on Substance Use and Addiction, they did a poll to Canadians. 25% of Canadians have increased their drinking during COVID times. And the main reasons, 3 top reasons, were lack of a regular schedule, boredom or isolation, and stress and anxiety. So again, we know that drinking increases in times of stress and anxiety, but we still need to be mindful, especially because this stress and anxiety is a virus. Because as Emily mentioned before, alcohol lowers your immunity. Next slide. So it's actually even more important now to reevaluate your drinking because, again, you don't want to get the COVID. It comes with it a lot of different problems. And if you are noticing you or someone you know may be drinking more or stockpiling some alcohol in your home, please do a bit of reflection. If it's someone else, support them, voice your concerns. Again, alcohol is not something that you should use to deal or cope with stress and anxiety. You can go down a slippery slope from there.
Great. Thank you, Rachel. And now we've reached the point where I just wanted to provide a few resources for anyone who either wants to seek them out yourself or for someone you know or love. The first one is the Center for Addiction and Mental Health. A quick search online at www.camh.ca will direct you right to their website. They have a number of programs and services to help support you when it comes to alcohol addiction. You can see right here that we've provided a number on the screen. This is a number that you can call to speak with a representative who will be able to discuss all of the different opportunities for addiction services and supports available to you in your local area. And you can call them anytime between Monday and Friday from 8:30 to 5 p.m. I have also included a link to this resource and all of the other resources that I'm going to be talking about in the description of our video if you ever want to check them out. Next, I wanted to just briefly touch upon Connex Ontario. Connex Ontario is one of the best sources for information when it comes to services in the province of Ontario. It's essentially a database which contains Ministry of Health funded and other government funded care. Essentially what you can do, as you can see here, is type in a keyword, type in your category, whether it's, for example, the options are gambling, mental health, addiction, etc., and your local area, and you'll be able to find all of the resources that are close to home where you can actually receive support for mental health, addiction, and gambling. And here's just one example. I typed in alcohol in Hamilton, and one of the first searches that came up showed me how far away it is from my location. It also gave me a description of the program and all of the additional information that may be relevant to me, such as what would this be costing me? Do I fit the criteria to be able to seek this resource? Is it wheelchair accessible? And what languages do they help serve? Another option right here, of course, we've all heard of Alcoholics Anonymous or Alcohol Anonymous. Again, I've included Alcohol Anonymous website for the GTA in the description of this video if you're interested in checking it out. Alcoholics Anonymous is famous for the 12 steps or the 12 principles which they go by to help you reach your goals. And Alcoholics Anonymous, the criteria is to get in is simply that you want to help both yourself and others. Alcoholics Anonymous is a really great service because it seems to be more of a peer support network where you're not only working on improving yourself and helping you reach your goals at the pace that works for you, but you're also listening to other people's stories and making connections in that way. And finally, a few other resources I've listed here are the Canadian Centre for Substance Abuse, the Ontario Addiction Treatment Centre, and the Addiction and Mental Health Ontario. Again, all three are good resources to check out. I've added the website to the description. And they advocate for very similar principles that I've touched upon with the other services, all about helping you reach your goals when it comes to managing your alcohol addiction or someone you love managing their alcohol addiction. So again, if you are interested, these resources are available to you online, but you can also find them in the description of our video. And with that, it brings us to the end of our discussion on alcohol awareness, and we hope you did enjoy. Again, our intention was never to preach or to force you to think a certain way, but essentially we wanted to just present you with the facts, the information, and offer you resources and questions and opportunities to think about your behavior or someone you love's behavior, how it may be affecting you, and what you can do to continue to live a healthy life, not just in the short term, but in the long term. With that, I'll pass it along to Dr. Kernu for his final word.
Wow, lots to think about, and is that it doesn't mean you can't enjoy a drink, but for many of us, one potato chip leads to a bag of potato chips, and Rachel, I did your questionnaire, and I'm addicted to nighttime eating, something that I still struggle with, I still work with, and I will find solutions and moving forward. So we didn't talk about all the different cures or help and things like that as well. I think the first step is that my experience is that most people aren't aware of the ill effects of alcohol. We were brought up that alcohol is social. It's part of our many cultures, and they have some heart health. But what we're finding out is that it has many more adverse effects. We didn't even enter the area of car accidents, losing your livelihood from not being able to drive. But I'm also reminded is that many people tell me that I can't sleep and alcohol helps me fall asleep. It does, but you don't stay awake and you have very poor sleep quality over time. I'm like most people trying to keep my weight down, and I'd rather spend my calories maybe your chocolate cake. But chocolate cake does have its disadvantages too as well. So I learned a lot, and I learned not to be hard on yourself. Don't get mad at the people around you who are concerned about you. Use the resources that are available and move forward. So we have our strengths and weaknesses. Mentioned your dad can exercise. I love exercise, and that's something that is the best thing for my mental health. But I have my weaknesses. I get impatient sometimes. I come to conclusions very quickly. I like to solve problems when people don't want their problems solved. So wonderful. So if you have any concerns that we can help in any way, you have our email address, and you can always call the office, and don't be afraid to talk about a problem. And I want to thank the entire team for just a job well done. Rachel or the rest of the team, any final conclusions or comments from anybody else? I just want to say thank you.
Yeah, I think Dr. Cunha makes a great point about how we are raised thinking drinking alcohol is a regular, normal thing to do, that this trend or this impression isn't catching up with science, which is telling us alcohol is not such a healthy or normal thing to do anymore, and it's probably trending towards we shouldn't be drinking alcohol at all. The evidence is trending towards we shouldn't be drinking alcohol at all, and hopefully the guidelines will follow soon.
Well, I just want to thank all the speakers and insights and share. And Stuart, I'll just give you the last word, and I want to bid everybody a good night. I have my bubbly water tonight, and I'm going to try to cut down my eating a little bit here, and I encourage people to look at this and to think and reflect. And I love those questionnaires that you put to us there, Rachel. Thank you for sharing that. Stuart, what do you want to say?
Well, I just wanted to first begin by thanking, obviously, Rachel, Emily, and also Alan, who worked on some of the slides but wasn't able to join us tonight. I just wanted to thank him for allowing me to speak for some of the work that he worked on in this presentation as well. I just wanted to maybe make one comment, and Dr. Kearney said this already, and he's told me this, and it kind of stuck with me, but it's, we live in a society now where the LCBO is an essential service, and that's the right decision. Obviously, we can't have somebody right now who's going with withdrawals, but I think it just shines a light on the prevalence of alcohol in our communities, and that it may be closer to home than we realize. It may be affecting somebody's life who's really close to us, and maybe we haven't started that conversation with them yet, or maybe we've not wanted to think that may be something that is in their life. And so I just wanted to maybe make a point on that. Today's presentation, by of course no means, was to tell you to completely stop drinking. You can certainly enjoy a drink now and then, but as Rachel talked about, the harmful effects far outweigh any benefits that they may be causing. And so if you are drinking for health benefits, then I hope this presentation tonight was an opportunity for you to learn what the science is saying these days, and maybe plant a seed in your mind of what is and what isn't good for you. With that, I just wanted to thank everyone again for joining us tonight. We'll look forward to seeing you next Friday. We'll be discussing a new topic, new things to share all the time, and we're looking forward to it. So thank you.